Have you ever gazed at an old photograph of yourself and found it difficult to recognize the person staring back? It's not because you've changed so much, but because our perception of ourselves is deeply ingrained. We see ourselves every day, not just physically, but through the mirror of our own memories, experiences, and feelings. So when we look into the mirror, we expect to see a consistent reflection of who we are. But what if one day you look in the mirror and find that reflection a little off? Maybe your smile seems lopsided, or one eyelid appears to droop lower than usual. At first, such changes may seem insignificant, easily dismissed as fatigue, stress, or a trick of the light. However, these seemingly minor alterations could actually be subtle warning signs indicating that your body is struggling to communicate with itself, hinting at a potential stroke that could occur at any moment. In today's episode, we will guide you through 8 unsettling signs that may manifest on your face, serving as potential harbingers of an impending stroke. It's important to note that while these signs are associated with strokes, their presence doesn't automatically indicate that you're having a stroke. Rather, they should serve as red flags prompting immediate medical attention to rule out any underlying issues. So keep an eye out for these signs and don't hesitate to seek medical advice. Your well-being is worth it. Number 1. A sudden droop on one side of your face. When you smile, do both sides of your mouth rise evenly? Can you raise both eyebrows at the same time? If you notice that one side of your face lags behind when you try to make a facial expression, don't dismiss it as a mere quirk. While we naturally expect some minor asymmetries due to our unique facial features, significant or sudden changes can be a cause for concern. This condition is medically termed as facial droop or facial paralysis, and when it occurs suddenly, it's crucial to take notice. A unilateral facial droop, whether it's a slight asymmetry when smiling or an inability to raise one eyebrow, might be an early indication of a stroke. This is particularly true when the affected muscles don't respond to attempts to move them voluntarily. Such symptoms can arise due to various factors, including Bell's palsy, which causes temporary facial muscle weakness, or, more seriously, a stroke that affects the facial nerve. Number 2. Sudden blurry vision, double vision, or temporary blindness. In one eye, do you occasionally experience blurry vision, double vision, or temporary blindness in one eye? Do you ever feel like the world around you has suddenly shifted and become distorted? As you look at an object, you might see a duplicate image beside the original. Or you could find it challenging to focus on something close up when you're reading or looking at your phone. Blurred vision, double vision, or temporary blindness in one eye might seem like a mild inconvenience, an annoyance that can happen to anyone. But if it occurs suddenly and without apparent cause, it's essential to pay attention. These symptoms might indicate that your brain is not receiving sufficient oxygen due to an interruption in blood flow. Consequently, your vision becomes affected, presenting as blurred, distorted, or even absent in one eye. While there are multiple medical conditions that can cause these visual disturbances, including diabetes, high blood pressure, and multiple sclerosis, it's crucial to consider the possibility of a stroke. If you experience any sudden changes in your vision, don't hesitate to seek medical attention promptly. Swift diagnosis and treatment can make a significant difference. Number 3. Strange tingling or numbness on your face. Have you ever brushed against something sharp or cold and felt a sudden tingling or numbness on your face or lips? Or perhaps you've noticed a persistent yet unexplained tingling sensation that comes and goes. If you've dismissed these occurrences as mere quirks or side effects of a cold drink, it's time to reconsider. This strange feeling, medically referred to as paresthesia, is your nervous system's way of signaling that something is amiss. It indicates a disruption in the normal sensations of touch, temperature, and pain. When this happens on one side of your face, it could be a sign that the blood supply to that area has been momentarily interrupted, causing the affected part of your brain to temporarily stop functioning properly. This condition is known as a transient ischemic attack, or TIA, and it serves as a warning sign of an impending stroke. Therefore, any unusual tingling or numbness on your face should not be ignored. Instead, it's vital to consult a healthcare professional immediately, as this could be your body's way of alerting you to a potential problem that requires attention. Number 4. Small twitches on your face. When we're tired or under stress, our muscles might react with small twitches or spasms, which are usually harmless and go away on their own. However, if you notice repeated twitching around your eye, cheek, or lip that doesn't subside, it's essential to pay attention. These persistent twitching could indicate a neurological issue known as hemifacial spasm. This condition can be caused by various factors, including exposure to stress, lack of sleep, or more seriously, a vascular problem like a stroke. Persistent facial twitching may also be accompanied by other symptoms such as slurred speech, dizziness, or weakness. These symptoms might suggest that your brain is not receiving adequate blood flow or oxygen, leading to a temporary malfunction in its processes. If you experience such twitching, it's crucial to consult a medical professional promptly. Early intervention can prevent further complications and ensure timely treatment if necessary. Number 5. Sudden pallor on your face, lips, or under eyes. Have you ever noticed your face, lips, or under eyes suddenly becoming unusually pale, grayish, or bluish? If you've experienced this and brushed it off as fatigue or a reaction to cold temperatures, it's time to reconsider. This unexpected paleness could signify a serious issue, potentially indicating that your brain isn't getting enough blood or oxygen. This condition is known as pallor, and it's often the first visible sign of a stroke. This is particularly concerning when the change occurs suddenly or is accompanied by other unusual symptoms. When your skin takes on a grayish or bluish hue, it means that your blood isn't carrying enough oxygen to your tissues. This might be because your heart isn't pumping properly, or there's a blockage in your arteries. Either way, it's your body's SOS signal. It's urging you to seek help fast. So if you notice this sudden change, don't hesitate. Act quickly and call emergency services. Every minute counts. Number 6. Sudden inability to control your facial expressions. Did you try to smile or frown and only one side of your face moved? This might seem like a minor oddity, but it's not. It suggests that your brain is struggling to communicate with the muscles on the right side of your face. This condition is called acute facial nerve palsy. It's often linked to strokes that affect the facial nerve, which controls muscle movement on the face. When this happens, your facial expressions become lopsided, or you might lose the ability to completely control one side of your face. You might be able to move your mouth, but raising your eyebrows or closing one eye becomes impossible. This is because the nerves connecting your brain to the muscles on the affected side have been compromised. Typically, the onset is sudden, occurring over a few hours or days. If you or someone you know experiences this, it's crucial to seek medical attention immediately. Number 7. Sudden, severe pain near your eye or temple. If you've ever had a headache that felt like a throbbing pain right behind your eye, you know how intense and uncomfortable it can be. But imagine that pain, not going away and feeling like the worst migraine of your life. That's what a hemorrhagic stroke can feel like. A subarachnoid hemorrhage happens when a blood vessel in the brain ruptures, causing blood to leak into the space between the brain and the thin tissue that covers it. This sudden, severe pain is often the first sign of a hemorrhagic stroke. Other symptoms include nausea, vomiting, a stiff neck, and even loss of consciousness. If you experience this kind of pain, it's critical to seek medical attention fast. It's essential to differentiate this type of headache from other types, as it can have very different treatments and outcomes. Number 8. Sudden confusion or difficulty speaking. Did you try to say something but the words came out jumbled and unclear? If you've ever experienced this strange mix of sounds instead of coherent words, you might have encountered the unsettling symptom of dysarthria. Dysarthria is a condition that affects the coordination of the muscles responsible for speech. It's often linked to underlying neurological issues such as a stroke. When this happens, forming words becomes challenging, and the flow of speech is disrupted, leading to unclear or slurred pronunciation. This symptom can be unsettling and frustrating for those who experience it, making everyday communication tasks like ordering food or asking for directions quite daunting. However, it's crucial to remember that dysarthria, especially when it strikes suddenly, could be a sign of a more serious issue at play, such as a stroke. If you or someone you know experiences this symptom, it's essential to seek medical attention immediately. Early diagnosis and treatment are key to managing dysarthria and preventing potential complications. If you found this video informative, please share it with your friends. Your support helps us spread awareness about stroke symptoms. Together, we can save lives. Thank you for watching. Stay healthy and take care.